Hi, Dr. St. Clair. My name's Lori Weiler, and I'm going to be presenting my presentation on Dr. Mary Keenan. She's the geropsychologist of the Alzheimer's disease and memory disorders here in Houston at Baylor College of Medicine. And I actually work with Dr. Keenan, so we have a very good and healthy relationship, and she is always more than willing to mentor me and answer any questions. So it was really great to be able to interview her and learn some more from her. The first question I had for Dr. Keenan was that knowing her past, just from, general conversation, I knew that she was originally an art history major and switched to the field of psychology. So I asked what happened, what made that occur, what was the shift? And she said she actually had some older generation loved ones who became ill, who became sick, who needed help, who needed family support. And she was able to provide that support and realize how much that is needed and how much she loved to do it. So she actually started out in geropsychology and started her career in it and is almost near retirement age. So she has done her whole life in geropsychology. I also asked about her grad school experience just because I was curious, and that's something that is worth knowing and asking questions about. And she said that for the most part it was good, and she really enjoyed grad school, but the first year was difficult because she moved from being at the top of a big class to being just ordinary in a small class, and also that just the final exam or the comprehensive uh, test or performance that they have to do at the end just was all consuming. It takes a lot of time, it takes a lot of effort. You really need to know your stuff, and she just wanted me to know about that and prepare for that, and just realize that it is so much work, but of course it's hopefully rewarding as well. I mentioned that geropsychology is a growing field, and I said, what would she say to another geropsychologist who may be interested in the field? What advice may she pass on? And she said that she just wanted to let them know that it's incredibly rewarding. It is just so fulfilling for her to serve as this role. But she also said that she feels the most important thing is to be passionate about what you do and to really care for others, invest your time, just love what you do. So, and she also stated that maybe this a personal connection is needed as well. So she said just make sure that what you're doing is what you love. Additionally, she said that there's so many areas of psychology and even geropsychology that you can go into, so you can kind of choose what you will succeed in and what you'll do well in. If it's clinical based, research based, education based, there's so many options. So choose something that you will strive in and succeed in. Lastly, she wanted me to know that she really likes her clientele base or her population that she counsels, just because they're so diverse and they've lived through so many things. She's learned so many things from her patients just because they're older. They've gone through stuff, they've lived through things, and that's just so cool to counsel people who have lived several decades versus a 10-year-old who may not know as much. She just finds it so rewarding to be able to learn things from them and interact with them and really just listen to them and hear them out and be able to apply things to her own life as well. I stated that her typical day is not average of a typical therapist because she does work specifically in memory disorders, and she does work in a clinic in a hospital-based setting. So I asked how is it different, and what would she say is different from the ordinary role as therapist. And the main thing she wanted to point out is that her role, she counsels patients maybe once or twice a year. She does not follow up with patients monthly, weekly, however it may be that you think of like a typical counseling session or a therapeutic process. She only counsels patients a few times a year. And so while she does counsel them only a few times a year, she sees them for several years. So she may be seeing patients for decades. So this allows her to become a part of their lives and to really invest in them and have a connection or a relationship that lasts several years. She also said that her role is a lot of based on psychoeducation a lot, that she really works with patients and clients to identify problems and really come up with solutions, come up with plans on how to address them. So it's a lot of working together. It's a lot of collaborative approach. It's a lot of finding a problem and trying to address it together. I also asked her what the most rewarding part of her job was, and she said just honestly allow patients allowing her to counsel them and talk with them and give them advice and help them solve these problems. She just finds it so incredibly rewarding that people allow her in and talk with her and want her to help, and she just finds it so rewarding to be able to help these people. She also really likes the setup of our model of work. She likes that it's a team model, that everyone helps each other out, that we're incredibly supportive, that she can go to people when she needs help, and that it's just such a great setup for success. I shifted gears a little bit and asked how she could address when difficult things come up. And she stated that she actually did reach a point of burnout. She actually did have to quit her job because she did not take care of herself. So she really wanted to emphasize that this is an incredibly important topic to address, and that you have to focus on self-care and take care of yourself. And now she takes time and sets time aside to really care for herself, put herself first, and also to surround herself with those who will encourage her to do so and be an environment that's incredibly supportive. I asked her how the field has changed because she's been a psychologist for decades. And she said the most thing that has changed or happened is just the exponential growth of using technology or using telemedicine to treat patients. And she loves that she's able to reach more patients, and that this is a new opportunity for people to be counseled that may not have the opportunity to come in person. This has, it greatly influenced the field, and she's incredibly happy and supportive that this has occurred. She also mentioned something that I wasn't aware of, and it's called PsyPact, and it is an organization that allows professionals, therapists, psychologists to practice across state lines. Unfortunately, Texas is not a part of this organization or does not offer it, but it is cool to know that we're growing in the field of psychology to be able to try to help patients all over, patients across state lines, patients hopefully eventually across the world, so we're able to reach those who are in need of maybe some extra help and cannot come in person. I asked her, of course, if there's been any ethical concerns in her decades of work, and she said the most time that she struggles with ethical concerns is when it comes to elder abuse. And she mostly said this because oftentimes with elder abuse, at least in the geropsych field, the person who is abusing the patient or neglecting the patient may not realize that they are doing so. Oftentimes, the older generation is caring for the one who has the illness. The other person also has some things going on, or is also older, and so at times it can be a situation where they're not even aware that that they're neglecting their loved one, or that they're not caring for them the best way. So she is really supportive of making sure that you consult others and you ask other team members, you ask other people how she should approach the situation, how should she, if it needs to be reported, if it needs to be taken care of, what can be done, what are some solutions, what are some plans. She really was appreciative that she has other people that she can rely on and ask for help. I asked if she could go back and change anything. Would she change anything? And she said just first and foremost that she would focus on self-care from the very beginning, and she wouldn't allow burnout. She wouldn't allow herself to reach that point ever again, because she lost so much time. She lost time doing the job that she loves, and she just would make sure that was a focus from the very beginning. I asked if she had any words of encouragement for the future generation of psychologists, and she said that future psychologists are needed and appreciated. They are needed and appreciated, and The options are limitless. You can do anything. And to find your spot, to find your place, to find find a career that will allow you to succeed, will allow you to strive, will create an environment for success. And she said there's a recipe. She says find a job you love, take care of yourself, and find a place that allows you to thrive and be successful. This will cause you and allow you to have a rewarding career. Lastly, I just wanted to reflect on my interview with her, and I found it incredibly rewarding, and I really learned a lot of things about Dr. Keenan in the field of psychology. What stood out the most was just that how passionate she was and how much the passion is needed to care for others, and that it's just so rewarding when you have that deeper connection, that deeper passion to want to help others. And she also, of course, just being able to take care of yourself. You have to take care of yourself before you can take care of others. So making sure that's a sole focus. And of course, just having a place, finding an environment that allows you to succeed and allows you to do well, and really digging in and searching for that, taking the time to invest in that, and being able to find a place that will allow you to strive and be successful.